Hi everyone, welcome to this case-based learning in pharmacology. So let's understand the drug-induced hyperprolactinemia. So in this session, you're going to learn about which are the drugs which are responsible for hyperprolactinemia and how to manage those problems, as well as the drugs which can relatively decrease the risk of hyperprolactinemia. So coming to the case, a 30-year-old female patient on antipsychotic treatment with risperidone consults her psychiatrist regarding her menstrual problems, enlargement of the breast and milk secretion from the breast. She complains that she has been experiencing these symptoms after the dose of risperidone was increased in her last visit to the clinic. So which are the key points which we need to identify from this case? A female patient was on risperidone, which was an antipsychotic drug, which led to the problem of menstrual disturbances as well as the enlargement of the breast and milk secretion after increasing the dose of the risperidone. So coming to the question. So what is the mechanism for hyperprolactinemia due to antipsychotic drugs? So basically you need to understand that prolactin secretion is under tonic control of the dopamine. So prolactin release is when dopamine secretion is inhibited. So prolactin is released whenever there is a dopamine secretion is inhibited. So typical antipsychotic have got higher affinity towards the D2 receptors and they block the D2 receptor. So that's why the inhibitory effect of the dopamine on the prolactin release is removed, thereby causing the increased prolactin release. So typical antipsychotics are known to cause hyperprolactinemia due to D2 blockade. So what are the effects of atypical antipsychotic drugs on prolactin levels? So most of these atypical antipsychotic drugs have got lesser affinity towards the D2 receptors and they have got relatively lesser risk of hyperprolactinemia. They mainly act on the serotonergic receptor. As you know that serotonin is a modulator of dopamine release. So whenever this atypical antipsychotic blocks the 5-HT2A serotonin receptor, they increase the level of the dopamine. So as you know that increasing the dopamine levels will reduce the dopamine, will reduce the prolactin release. So thereby it causes decrease in the risk of hyperprolactinemia. So aripiprazole is a atypical antipsychotic which acts by a partial agonistic activity at T2 receptors and they have got antagonistic activity on the 5-HT2A receptors. So basically aripiprazole will decrease the serum prolactin levels. So what is the mechanism that you need to remember? So atypical antipsychotic by acting on 5-HT2A serotonin receptor, they block those serotonin receptor, thereby they increase dopamine levels. As you know that increase in dopamine levels will decrease the release of the prolactin. So typical antipsychotics will block D2 receptor and they increase prolactin levels, whereas atypical antipsychotics will block the serotonin receptors and they decrease the prolactin levels. And one more thing which you need to remember is the typical antipsychotic have got higher affinity towards the D2 receptors, whereas atypical antipsychotics have got lesser affinity towards the D2 receptors. So how would you treat symptomatic antipsychotic induced hyperprolactinemia? So in a symptomatic patient, two things can be done. So dose has to be reduced or you need to switch to the agent which has got lesser potential to cause D2 blockade. That is the true choice which is available. If the clinical condition doesn't allow to reduce the dose or to switch over to the other agent, you need to go for dopamine agonists like bromocriptine, cabergoline, and amantadine, which can decrease the risk of hyperprolactinemia. Or studies have shown that adjuvant use of the aripiprazole will show the decrease in the serum prolactin levels. So either you have to reduce the dose or switch over to the another agent or use a dopamine agonist like bromocriptine, cabergoline and amantadine or use a aripiprazole atypical antipsychotic as a adjuvant drug. So take home message point and a summary. Uh, Typical antipsychotic blocks D2 receptor, they increase the prolactin levels. Atypical antipsychotic, they have got D2 agonistic and they block the serotonin 5-HT2A and decrease prolactin release. Remember, D2 agonist decreases prolactin, D2 blockers increases prolactin. 5-HT2 blocker increases dopamine, which is responsible for decrease in the prolactin release. Thank you. If you find this video useful, please do subscribe to our channel I Love Pharmacology for more updates on pharmacology. Thank you.